Welcome to the Omnidental Podcast.
It's fantastic to be here today.
I have to be completely honest right off the bat. When we decided to tackle this specific topic today, I had a bit of a mental block.
Oh, really?
Yeah, I saw the word veneers in our notes, and my brain immediately went to one place, the red carpet.
Oh, naturally. It's the classic Hollywood smile.
Exactly. I'm thinking of those blindingly white, perfectly uniform, almost Lego-like teeth you see on reality TV stars.
Right, the chiclets look.
Yeah. I've always categorized veneers in my head as this pure vanity project. You get them because you want to look perfect, not because you actually need them for your health.
Just an expensive accessory.
Right. It feels like buying a flashy spoiler for a car that has a completely broken engine. Purely cosmetic.
Yeah.
But looking at the research we have on the table for today's deep dive, I'm realizing I might be completely wrong.
Well, you are definitely not alone in that assumption. Most people think of veneers as just jewelry for the mouth, but the reality is so much more nuanced.
Which is why we're doing this.
Exactly. There is this central tension here that I think is totally fascinating. The idea that something designed specifically for beauty might actually serve a heavy-duty structural protective purpose.
Right, it's like finding out your designer sunglasses are actually military-grade ballistic eyewear.
That's a great way to put it.
So that's the real mission for this deep dive. We are going to figure out if veneers are just for looks, or if they can actually save a weakened tooth from falling apart.
And to guide us through this, we are looking at the philosophy and the actual daily practices of Omnidental and med spa.
Right, and they are based out of Arlington Heights, Illinois.
Yes. And before we get into the nitty-gritty of porcelain physics and enamel, let's kind of set the scene for the listeners.
Yeah, let's do that, because looking at Omnidental, this doesn't feel like a sterile, cold, clinical factory.
Not at all.
Nor does it feel like one of those hyper-intimidating Beverly Hills aesthetic centers where you're afraid to even touch the waiting room furniture.
Right, where everything is white leather and glass. No, the vibe here is distinctly a trusted family practice.
They specifically emphasize a patient-first mentality.
They do, and it's interesting because they seem to be occupying this really unique space. They are bridging the gap between high-end cosmetic work and the kind of place where you'd feel totally comfortable taking your kids for a Tuesday afternoon checkup.
Leading that charge is Dr. Poles.
I was looking into his background for this, and he's got over a decade of experience.
A very solid track record.
But what really stood out to me wasn't just his cosmetic portfolio, it's that he actually specializes in treating dental injuries and emergencies.
Now, see, that is a massive detail.
Really? Why is that so crucial?
Think about it. When you have a dentist who is used to seeing absolute trauma-like smashed teeth from sports injuries or emergency breaks, they look at a smile very differently than someone who is only focused on aesthetics.
Oh, I see. They aren't just looking at the surface.
Exactly. They intimately understand the structural integrity of the tooth. Dr. Poles seems to bring that intense engineering precision to the table, along with what patients describe as a very friendly, approachable manner, which is key because nobody wants a technician who acts like a robot. You want to feel heard.
Especially when you're in a dentist's chair.
Now, for our listeners who are trying to place this on a map, Omnidental is right at 305 East Rand Road in Arlington Heights.
But looking at their service area, they actually cast a really wide net.
Yeah, this feels much more like a regional hub than just a neighborhood clinic.
It really is. They aren't just serving their immediate block. If you look at the communities they cover, you've got Buffalo Grove, Palatine Mount Prospect.
Rolling Meadows is on there too?
Yep, Rolling Meadows. And it's really that whole northwest suburban corridor.
I saw Schaumburg and Wheeling on that list too.
And even Des Plaines and Elk Grove Village.
It really suggests that people are willing to drive a town or two over simply because they trust the provider.
It's that family dentist feel we talked about, but with the capabilities list that seriously rivals a downtown specialist.
Speaking of capabilities, before we dive into the teeth themselves, there's one other thing about the name Omnidental and med spa.
The med spa part.
Yes. The med spa part catches my eye. Usually my dentist just lectures me about flossing and sends me home. They aren't exactly offering me aesthetic treatments.
That is the holistic aspect coming into play. They aren't just fixing teeth. They offer aesthetic services like Botox and fillers.
Which hints at a philosophy where they are looking at the entire face, not just the mouth, in pure isolation.
We definitely need to put a pin in that because the connection between the dentistry and the med spa side is actually a lot deeper than just quote-unquote looking good.
Okay, consider it pinned. Let's unpack the core concept here. We are talking about veneers. If I'm at a dinner party and someone asks me what a veneer is, aside from just saying expensive teeth, what is the actual technical definition we are working with?
The most accurate technical definition is that they are thin shells,
Hmm.
specifically custom-made shells of tooth-colored materials designed to cover the front surface of teeth.
The front surface. So it's not a whole new tooth.
No.
It's just a facade.
Ideally, yes. Think of it kind of like a false fingernail. But that analogy kind of falls apart when you talk about the material. We aren't talking about cheap plastic here. We are talking about high-grade dental porcelain.
Why porcelain, though?
Yeah.
I usually associate porcelain with fragile tea sets or those little antique dolls that break if you look at them wrong.
Right, sounds delicate.
Wouldn't you want something like titanium or some crazy space-age resin in your mouth?
You would think so, but in dentistry, you are fighting two wars simultaneously: durability and aesthetics.
Okay.
Titanium helps you chew, absolutely, but it looks like you're a robot. Resin looks okay, but it easily stains and it wears down fairly quickly.
So porcelain is the sweet spot.
Porcelain is entirely unique because it mimics the light refraction of natural enamel almost perfectly. It has that very specific translucency.
It looks real.
It looks incredibly real. But, and here's the physics part of the equation, when it is bonded to a tooth, it gains unbelievable compressive strength.
So it's weak on its own, but strong when it's stuck to something solid.
Exactly. It becomes what we call in the field a monolithic unit with the tooth.
Okay, but how do they actually get it to stick? Because I imagine if you just superglued a shell onto my tooth right now, it would feel incredibly bulky. I'd feel like I had horse teeth.
You absolutely would. Your lips would stick out. That's why the preparation phase is so critical. The process involves minimal enamel removal.
Minimal enamel removal.
Right. The dentist gently shaves off a tiny fraction of the natural tooth surface. We're usually talking about 0.5 millimeter before the placement.
Well, hold on. Let's pause right there. You are telling me that to protect my tooth, they have to shave parts of it away.
Yes.
That sounds completely counterintuitive. If I have a weak tooth, isn't taking a drill to it the absolute last thing I want to do?
That is the most common objection patients have, and it's a completely valid fear. But here's the actual science behind it. You aren't just making space for the porcelain so it fits flush with the gum line.
Though I assume that is important so it doesn't look bulky.
It's vital for aesthetics, yes. But beyond that, you are actually creating a textured surface for the bonding agent to grip onto.
Oh, I see.
Natural enamel is very smooth. To get that military-grade bond we talked about earlier, you need a highly specific surface profile. By removing that microscopic layer, they're actually enabling the veneer to become a structural integrated part of the tooth, rather than just something floating loosely on top.
Okay, I see it now. It's exactly like sanding a piece of wood before you apply wood glue. You need that rough grip.
Precisely. And once that bonding agent cures the porcelain, literally acts as a shield.
So that brings us to the why of it all. This is the real deep dive part for me. Can these things actually protect a tooth? Because usually when I think of dental protection, I'm thinking of a sports mouth guard or a helmet, something you actively take on and off.
Right, a temporary barrier.
But this is permanent.
To really understand the protection aspect, we first have to understand the enemy. Why do our teeth get weak in the first place? It's rarely just bad luck.
Well, the source material gave us quite a laundry list of enemies. Acid reflux was a surprisingly big one.
It is a massive factor.
And I think a lot of people just completely ignore that. They think heartburn is strictly a stomach issue, not a tooth issue.
It's a chemical attack on your mouth. Acid reflux brings potent stomach acid up into the oral cavity, and that acid literally dissolves the critical minerals in your enamel.
Just eats it away.
It eats it away and leaves the surface pitted thin and extremely weak.
Then, of course, there's the usual suspects, sugary foods, bacteria. But the one that really made me wince when I was reading was grinding.
Bruxism, yes.
Just the sheer idea of that daily pressure grinding your own teeth down while you sleep, it makes my jaw ache just thinking about it.
It is severe physical trauma. Think about the incredible force the human jaw can exert. It's immense. Over time, that nightly grinding acts exactly like heavy grit sandpaper.
Yeah.
It wears down the natural enamel barrier entirely. And once that enamel is thin, the softer inner part of the tooth, the dentin, becomes exposed.
And that's where the pain starts.
That's when you get intense sensitivity, hairline cracks, and eventual structural failure. It's like a solid castle wall that's been bombarded over and over until it's paper thin.
So here comes the veneer to the rescue. The documentation from Omnidental used a phrase I really liked. It described the veneer as a reinforced outer surface.
That is the perfect armor analogy we were looking for. When you bond that durable porcelain shell to the front of a weakened tooth, you are effectively replacing the lost enamel with material that is often harder and more resistant to stains and daily wear than the original surface ever was.
Especially if that original surface was already severely compromised.
Exactly.
So it's essentially sealing the breach in the castle wall.
It seals the breach, it completely restores the natural shape, and crucially, it takes the physical impact of chewing, so the fragile underlying tooth structure doesn't have to bear the load anymore.
But, and here's where I want to push back just a little bit, it's not a magic wand for absolutely every broken tooth, is it? I mean, I can't walk into the clinic with a tooth that's crumbled all the way down to the gum line and say, veneer me, Dr. Poles.
No, absolutely not. And this is exactly where the professional expertise of someone like Dr. Poles at Omni Dental becomes totally non-negotiable. You cannot just slap a veneer on a tooth that is completely destroyed. There are very specific use cases.
Let's list those out for the listeners. When exactly does the veneer work as this armor?
It works brilliantly for minor chips. If you have a small piece missing from the biting edge, a veneer restores that specific shape and seals the break, so harmful bacteria can't get inside the tooth.
What about cracks?
It works for surface cracks, those tiny hairline fractures that might not actually hurt you yet, but could very easily split wide open later under the pressure of a hard meal.
And the worn edges we talked about.
Yes, exactly like we discussed with the grinding. If you've worn the edges down completely flat over the years, a veneer can seamlessly rebuild that lost length and protect the vulnerable biting surface. And finally, it works for general enamel erosion.
So if the barrier has thinned out from, say, a decade of acid reflux or just aging, the veneer becomes the brand new barrier.
Exactly.
So it's kind of like if your house has peeling paint and some really weathered old siding, you can put brand new high-tech siding on it, and it looks and functions as good as new.
Good analogy.
But if the actual internal framing of the house is rotting away, slapping new siding on is just covering up an impending disaster.
That is a fantastic way to look at it. And that brings us perfectly to the underlying nuance of this whole situation. There is a very strict, non-negotiable rule in dentistry regarding veneers.
What's the rule?
Adequate remaining enamel.
Why is that the ultimate deal breaker?
Because of the chemical and physical bond. Remember when we talked about sanding the wood?
Yeah, the grip.
Porcelain bonds incredibly well to natural enamel. It bonds okay to dentin, which is the inner tooth, but nowhere near as strongly. If you do not have enough healthy enamel left for the bonding agent to grab onto the veneer, is going to be fundamentally unstable. It might just pop right off while you're eating an apple.
This raises a question I think a lot of patients probably ask themselves. If I actually go down to Omni Dental in Arlington Heights tomorrow, and Dr. Poles looks at my tooth and says, I'm sorry, but there's just not enough enamel left for a veneer. What happens then? Do I just lose the tooth entirely?
Not at all. This is where we have to clearly distinguish between a veneer and a crown.
Okay, let's break that down. Veneer versus crown. What's the difference?
A veneer, as we firmly established, covers just the front surface. It's a facade. It is considered a conservative treatment because it saves as much of your natural tooth as physically possible.
Right?
A crown, on the other hand, covers the entire natural tooth. It's like a thick helmet or a protective cap that goes all the way over 360 degrees.
So the crown is bringing in the heavy artillery.
Exactly. If the damage extends much deeper into the actual tooth structure, say if the decay is really deep or a massive chunk of the tooth is physically missing, a veneer simply isn't enough. You need the full structural support of a crown to literally hold the remaining tooth together.
And making that choice isn't just a guessing game.
Oh, definitely not. It requires a highly comprehensive exam. They have to precisely measure the enamel thickness. They have to carefully look at your individual bite pressure.
Because everyone bites differently.
Right. If you are a notoriously heavy grinder, a veneer might pop off under that extreme force, whereas a crown acts like a sturdy brace that safely withstands the pressure. It is a critical medical decision just as much as an aesthetic one.
That makes total sense. It really reinforces the idea that you absolutely need a seasoned professional to make that call. You can't just walk into a clinic and order off a menu like it's a fast food joint. I'll take 3 veneers, a crown, and a side of Botox, please.
Well, you can easily get the Botox there, but the veneers definitely need a medical prescription and a thorough structural evaluation.
Speaking of longevity, let's say I'm actually a great candidate. I've got my enamel, I've got some minor chips that need fixing, and I decide to get veneers at Omni Dental. How long is this porcelain armor going to last me? Are we talking about a permanent lifelong fix here?
We are typically looking at results after 10 years as a very standard benchmark in the dental industry. That implies a highly significant level of long-term durability. Porcelain is remarkably tough, but, and there is always a but, with these things, it depends entirely on how you treat them at home.
What's the daily maintenance protocol look like? Do I need some expensive special polish? Do I need to sleep upside down?
Actually, the routine is surprisingly standard, but you have to be mindful and gentle. You need to brush, obviously, but you absolutely must use a non-abrasive toothpaste.
Okay, so no harsh chemicals.
Right. Porcelain itself doesn't decay, but the surface can be permanently scratched if you use something too gritty. Things like fashionable charcoal pastes or really harsh baking soda blends are a terrible idea.
Good to know. And what about flossing?
Entirely non-negotiable. You have to floss every single day. Remember, the living natural tooth underneath that shell is still very much there.
Right, it's not invincible.
If you get gum disease, the gums will physically pull away from the veneer, and that exposes the vulnerable margin. That margin is exactly where harmful bacteria gets in, and that can rapidly undermine the whole structural integrity we just talked about building.
There was one massive, big don't regarding daily habits that really stood out to me in the research.
Let me guess. The ice.
Yes. No chewing ice under any circumstances.
Please, for the love of your expensive dentistry, do not chew ice. Do not chew on your pens when you're thinking. Do not ever try to open a beer bottle with your teeth.
Does anyone actually still do that? Open bottles with their teeth?
You would be absolutely horrified by the kind of trauma emergency dentists see on a weekly basis. But the core point is this. Veneers are incredibly strong in compression, meaning biting straight down on your food. They are completely not designed for sheer torque or a sudden sharp impact on completely hard objects. Porcelain is ultimately a glass-like material. Under the wrong angle of stress, it can and will shatter.
So the takeaway is treat them like very expensive high-quality china. Use them for eating dinner, not for doing construction work.
Ideally, yes. And the final critical part of the maintenance routine is your regular checkups. You need Dr. Poles and his dedicated team to keep a close professional eye on those margins we mentioned. The tiny edge where the veneer meets the natural tooth.
Because that's the weak point.
That's precisely where problems usually start if they're going to happen at all. Catching it early is everything.
Now, I want to circle back to the med spa part of Omni Dental and Med Spa. We touched on it briefly earlier, but looking closely at their expensive services list, they specifically talk about Botox versus fillers.
They certainly do.
At first glance, to an outsider, that feels like a massive detour. We're spending 20 minutes talking about the deep structural integrity of teeth, and suddenly we're pivoting to talking about forehead wrinkles. But looking at how Omni actively operates, this isn't just some random add-on service, is it?
No, it really isn't, and this is exactly where the deep dive gets genuinely fascinating. If you connect the clinical dots, it completely reveals the practice's overarching philosophy on the whole face.
The complete face and smile package.
Exactly. Think about a beautiful painting in a museum. The teeth are the painting itself, but the lips and the surrounding skin are the frame holding it. If you spend thousands fixing the teeth but completely ignore the aging frame, you might not actually get the cohesive aesthetic result the patient ultimately wants.
But why on earth is my dentist doing Botox injections? Shouldn't I be going to a specialized dermatologist for that kind of thing?
Actually, when you look at the anatomy, dentists are arguably the most qualified medical professionals to do facial injectables.
Really? More than a skin doctor?
Think about their intensive daily training. They spend their entire demanding career studying the complex maxillofacial structure, the intricate nerves, the specific muscles, the exact bone structure of the face. They know precisely down to the millimeter where every single facial muscle anchors.
That makes perfect sense, actually. They are routinely giving precision injections in that exact area all day long anyway to numb you.
Correct. Their needle control is unparalleled. And here is where it brilliantly connects right back to the veneers. Remember when we talked about the severe dangers of grinding? Bruxism.
Yeah, the ultimate enemy of the enamel.
Well, modern dentists frequently use Botox not just for smoothing out cosmetic wrinkles, but to actively treat the masseter muscles. Those are the powerful jaw muscles that actually cause the severe grinding.
Oh, wow.
By strategically relaxing those specific jaw muscles with targeted Botox, you can actually stop the destructive grinding right at the neurological source.
So the Botox literally protects the expensive veneers you just put in.
It can absolutely do that. It becomes a totally symbiotic treatment plan. You use the strong veneer to definitively repair the existing damage to the tooth, and then you use the therapeutic Botox to physically stop the jaw muscle from doing any further damage to your new smile.
That is brilliant.
That is exactly why having a combined dental and med spa clinic under one single roof like Omni has set up in Arlington Heights is actually a massive strategic medical advantage for the patient.
It's not just about looking young for a high school reunion. It's about fundamental daily mechanics.
Precisely. And just like we had to carefully distinguish between using a veneer and using a crown, patients also have to distinguish between using Botox and using fillers. The medical philosophy is exactly the same. You have to use the right tool for the right job.
Right.
Botox effectively stops specific muscle movement, which makes it great for grinding and dynamic creases. Fillers, on the other hand, add physical volume, which makes them great for shaping and lifting.
It really highlights that the entire practice focuses heavily on informed patient decision-making. Whether you are actively choosing between a veneer and a crown for your damaged tooth, or debating Botox and fillers for your face, OmniDental seems really focused on making absolutely sure you understand how the actual treatment works mechanically before you ever sign up.
They truly want you to know the underlying mechanics, not just the glossy marketing pitch.
So let's try to bring this all together for our listeners. We started this whole deep dive with a very specific question. Can veneers actually protect a weakened tooth?
And the conclusive answer, based on the science, is a highly qualified yes.
Let's quickly recap the major findings for anyone maybe driving down Rand Road right now, casually wondering about their own smile in the rearview mirror.
Veneers fundamentally act as a heavy-duty reinforcement. If you suffer from enamel erosion from acid reflux or chronic grinding, or if you have those structural minor chips that porcelain shell bonds permanently to the front of the tooth and acts as a brand new, incredibly durable barrier, it takes the daily hit so your fragile natural tooth doesn't have to anymore.
But the crucial catch we discovered is...
The catch is always the underlying structure. You absolutely need enough existing healthy enamel left for that porcelain to properly bond to. If the tooth is simply too far gone or the structural damage is too deep, a veneer is simply not the right tool for the job.
You need a full crown instead.
You need a structural architect, not just a cosmetic builder.
So if you are listening to this right now and you happen to be in Arlington Heights or Buffalo Grove, Schaumburg, Palatine, really any of those surrounding Northwest areas, you've been looking at your smile recently thinking, man, my teeth look really worn down and fragile, it might genuinely be time to make a quick phone call.
It really might be. OmniDental and MedSpa sounds like they are perfectly equipped and ready to help you figure out if you just need a cosmetic upgrade or if you actually need a full-blown structural rescue mission.
Or knowing what we know now, quite possibly both.
Very often it is precisely both.
Before we officially sign off, I want to leave our listeners with one final thought to mull over. We spend so much of our lives rigidly compartmentalizing our personal health. We have our standard medical stuff, which we view as boring and strictly necessary.
Right. Medical goes in one serious box.
And then we have our cosmetic stuff, which we view as totally optional fun and inherently vain.
We do tend to constantly draw that really hard imaginary line.
But looking closely at this deep dive on veneers today, that line is totally blurry, almost non-existent. Preserving your natural enamel is a strict medical necessity. If you let it fully erode, you will painfully lose the tooth.
A completely preventable loss.
So in this very specific case, the most beautiful aesthetic option available, the perfect porcelain veneer, might actually be the most responsible hardcore medical choice you could possibly make to permanently stop your tooth structure from crumbling away into nothing.
That is a deeply profound way to look at it. Sometimes pure beauty is highly functional. The aesthetic choice is actually the ultimate preservation choice.
It's definitely not just vanity anymore. It's vital daily maintenance.
I couldn't agree more.
Well, that is absolutely all the time we have for today's deep dive. A huge thank you to Dr. Bayless Poles and the entire team at OmniDental for providing the incredible insights and source material that made this possible.
It was an absolute pleasure unpacking all the science and mechanics behind it today.
And to all of our listeners out there, keep smiling and maybe go check on that enamel in the mirror tonight. We will see you in the next deep dive.
Goodbye, everyone.